I would like to bring this Health and Human Services Committee meeting to order. It is August 19th, 2025 at 3:45 p.m. We are going to start off with Commissioner Gibson and DSS.
Hi, Mrs. Gibson.
Hello, folks. I'm coming down without asking for anything. You gotta like that.
Wow.
I saw that on this thing. I went, what?
Are you softening us up for next month?
Yeah.
Or Thursday. Anyway.
But I do want to put something on the committee's radar, and it's not by way of softening, but there will be a contract. It would appear coming somewhere down the pipe because I've been speaking with the folks at the Berkshire Motor Launch. Supervisor Adams has helped arrange that, given that it's in her town, about the possibility of another Galvin type facility and arrangement and relationship. They've gone now as far as to engage an architect. They're looking at the space. And so I would be very excited to do that. They've seen, generally they know what the funding looks like in that, and they're very much open to that kind of funding. We would get back down to particulars with them on that again after, assuming some renderings get made and he enters into a contract to do it and wants us to enter into that.
The same model as the Galvin model.
Same model.
And they're struggling, I think, with mixing the general population and our population.
Yeah, that's exactly right. In fact, a year ago, we went out to see them and they then agreed without a contract, look, we'll just take DSS clients and we'll open up the rest of our rooms, which was a great help this winter. We do have 27 rooms out there. What's more enticing is the footprint, because they have some common area space that can really be built out. And we're talking about, spaces for washer, dryer, conference rooms, offices, a common room, a kitchen, and there's an apartment for a family, and it's a true apartment. But it could be used for emergency purposes. So families could come in and out of there as we wait to get them the permanent housing. So it's a real encouraging development. It's taken a good year to negotiate even to this point. But I will probably be bringing down some sort of contractual proposition for we'll get it well in advance so you can all look at it and we can talk about it one committee. And I'm also happy to do a breakout session with it separate and get into that. I think before we did it last time, we were very focused on what it should look like and what we were going to do. I think we should do that again. Yeah,
I agree. Just to show that we did due diligence.
Yep. Yep.
What's their time frame for being ready for this? So you talked about bringing in an architect. Are they doing major work to get to this? I don't know the facility very well, other than the fact that it was.
Well, it needs the work to
Right.
become the facility that we'd like it to become in contract
Right.
for. But it's certainly doable. It's a very reputable architect who I'm not sure is willing to be GC on it, but I understand that Brenda may be able to really convince him that he would be. And, he's had a lot of success. Time frame, it's going to take some time. I already have all the rooms, so I'm set for the fall, and I'm very happy about that. What I would really be happy for is I can now contract with a service provider, have them up there full time,
If we have
and take
long-term
transportation,
contract, right.
perhaps lessen that a great deal. And also we've been working on the bus line to get up there. So there's a lot happening. With the eastern part of the county.
So, Ron, they've rehabbed all the rooms on their own in the last 18 months. So
Okay.
all the rooms, we were going to do inspections, but there's very little mold or any of that kind of thing. The rooms are basically new.
Okay.
So we're really talking about the common spaces
Right.
and making sure the infrastructure, the well and the drainage and the generators are done. So, because the other thing is in the event of a bad snowstorm, we don't want to have to move 40 people because we don't have a place to take them to. So
Yeah, that was the flip side of this.
A year or something.
less than,
Oh, yeah.
much less.
You know, on the flip side, we've had to move folks out of that area and and the power has been lost for days at a time. So we really needed to sort of start focusing in on that particular hotel and saying, hey, you know, we're going to need more than that. And then that talks just developed. So it's good.
Good.
And as you can see, numbers holding steady there. And I expect a rise. I do expect a rise. I do expect to open the warming center again, 1 November. You know, always a tough time of year because I'm waiting to see, am I going to get the same code new budget? We can all relate to that, right? We're all in the midst of our budget discussions, but, you know, barring anything truly unforeseen, we're going to be able to operate. So, that's really what I had. I just wanted to update it.
Thank you.
Thank you, Commissioner.
Thanks for all your help on that.
Next up, Department of Health.
Did you want to do yours upside down?
Did I do
Turn it
that?
upside down.
Your agenda.
Have to lean in a little bit.
Got 2 requests here. Authorization to contract with Hudson City School District by preschool services.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Personnel request to abolish 1 public health nurse position and create and fill 1 licensed practical nurse.
And that went through .1. I'll move it. I'll second.
Further discussion? All in favor?
Aye.
Opposed?
And it's savings.
Yes,
A lot of money.
yes.
Is the market better for money?
We've gotten interest from LPNs for our current posting, so that's good enough
Yeah.
for the moment.
I hear you.
Yeah. So here's my report for July. Let me know if you have any questions. July feels like a long time ago.
Getting to September.
The year for all tick-related diseases are way up.
Yes, yes.
Between 26 and 46%.
Yep, yep,
Year over year.
significant.
Tell me.
Yeah, that's probably not news, but, yeah. We did have, if you'll recall, there was the, measles exposure, in the Albany Medical Center and Saratoga Hospital that happened in July. Again, feels like forever ago. We did cooperate. We had, some community members that found themselves in the ED, but we contact traced them and, they were fine, thank goodness, but a bit of a scare, of course.
I watched this show yesterday on TV on how to prepare your child to go to the doctors for immunizations.
Oh, yeah?
Yeah.
Anything good there?
Poke them with
I
the
never
thumbtack
remember. My mother
randomly,
watched it
conditions.
when we were little. All 5 of us went. I never remember. It's like, come on, we're going.
Yeah.
You know?
Yeah.
Yeah, and
Any
standing in line at school.
Mhm. Any
Yeah.
other questions about anything?
Your public health engineer, your new hire, right?
He's here, yep.
Is the overlap finished?
No, so
No.
Mike's final day is Friday, which is is that the 22nd? Yeah.
So a little bit of
They
time
went out,
Yeah.
and did-
with
they went-
mentorship.
Yep, yep. They went out and did Hudson today, and so there's plenty of overlap. Phew.
Right.
So when I come in for a bathroom for my shop, I can expect him to do all the work for me and get some drawings out of him and I can take care of it. No?
No, sir.
It's all done now.
Yes, I can. But I don't have that rubber stamp that I took.
That's right.
I got one. Not the most important. Any questions for Director?
Thank you.
Thank you very much.
Thank you.
Next up, Office of the Aging.
Come on, Mary. That's for third today, right?
It's usually best for luck. I also don't have any requests for you and this month, just some updates. We are burning through farmers market coupons, which is good because we've got a ton of them this year. So as of, Friday was the 15th, I think, when I typed this up, we had 504 remaining. I know several more went out yesterday and today. So just so you're aware. We were at that senior resource fair with Senator Henchy July 3rd. Bank of Greene County Charitable Foundation gave us a $10,000 grant to go towards our senior home repair fund, to kind of re-up it from last year. And then they also stuck $500 in there for our senior stars program, which was a very pleasant surprise. We opened up the envelope and there were 2 checks and I was like, oh, okay, thank you. We are starting the Medicare 101 seminars, I believe tomorrow. Yeah, today's the 19th. Tomorrow's the first one that kicks off in Hillsdale, and then we've got 2, one in North Chatham and one in New Lebanon coming up, for all your Medicare needs. Our senior day, the wait list, I think we have actually hit the max as of today. So we are now building a wait list. Did I say, what did I just say?
We've hit the wait list as of today,
Okay,
which is 250.
yes, so we are now taking names on the wait list for, if people call and cancel, so that we're still accepting interest for people to come and request a meal and things like that, but we have filled up quickly there.
It's not gonna be like Lollapalooza, people jumping the fence to get in.
I mean,
That would be interesting.
we shall see.
I want the beef stir fry.
Yeah, I was gonna say.
See how I segued into your next
I
point
did.
like that?
Well, I broke down attendees based on town, just because I thought that would be interesting to see. And I'm hoping to try and between building up our advisory council, me going around to doing the town board presentations, we can hopefully see some of those towns that don't see a lot of people coming to senior day, kind of bulk up over the next year or two.
Same place, same time, same venue.
All different. This year we're at the Columbia County Fairgrounds. The Columbia County Fairgrounds, at the pavilion, commonly referred to as the beer tent, although there will be no beer for our anti-Lollapalooza event. It will be Wednesday, September 10th, 10:30 to 2:30. We've got Mr. Dinglin lined up as usual, because if he wasn't there, I would be assaulted, I think, probably. We've got a ton of vendors coming in. We've got hopefully some
People
fun.
probably lining up now to get in, so.
Yeah. Yeah.
I thought it was in the fair house, so it's in the.
It's in the pavilion.
Okay.
Yeah, the beer tent behind the grandstand.
Yeah.
So we'll come in through that, the Route 66 entrance, come in through that chain link fence, past the little ticket booth, parking right next to the building. We're gonna have a big tent for vendors right next to the pavilion. We've got the DJ set up. We are trying, although she hasn't fully committed yet, but I think we're gonna bully her into doing it. Our nutrition program coordinator's niece has a beautiful voice. She's like 15 or 16, I think. So we think we're gonna get her to sing 1 or 2 songs, which I think will be nice. Some dancing going on. Very excited. Stressed beyond belief with the planning. Now we're diving into decorations. So if anyone would like to paint things and do arts and crafts with me, my office is always
It's like
open.
planning for crying out loud.
It's sort of put together. It's a lot.
Just don't paint the pavilion, the fair board.
Yeah.
No, we're not allowed to do that. Although I'm thinking some like fun streamers, those reflective wall hanging things in the back. Trying to collect some information about like OFA history, Youth Services history, to bore everybody with fun facts. The menu items, I have slowly been building. So when we started putting out new meal items, we started to also utilize our Blooming Health messaging, the automated messaging system, to start sending out surveys to get feedback on the new menu items. So I've been collecting data, and I've slowly figured out how to put it into a lovely graph for you to see.
Is yours in color on the screen when you scroll down?
If you scroll down a little bit.
No.
It's not.
Mine's not either.
Oh.
Yeah, it's okay. It didn't.
Sorry, I know you might not have sent it.
I might have, but you might not have either.
I'm gonna try to figure out a better way to do this, but I have it broken up by kind of each of the meal items that have gone out. Although I feel like there's not enough, I don't think I figured this out because I feel like there's more bars than there are meal items on the right. So we'll work on that. But we're getting pretty positive results back from the majority of our new meal items, which is good. Some of the comments in there, you know, one of the chicken dishes, the chicken was pretty dry, so we're taking that and trying to work with things. I think it was yesterday was like hot dogs and pierogies, and I tried it, and the, you know, broccoli was a little mushy for my taste, so we're gonna also look at how we can kind of update that a little bit. So lots of things changing over there. We have,
Of course, your dental structure is probably far better than the other
That's
individual.
what we
communities.
need.
I paid a lot of money for these. Actually, I didn't. My parents paid a lot of money for these teeth, so yeah. Yeah, the vegetables have been something we've been toying with for quite some time because holding the temperature to keep them at, you know, above 140 degrees is very hard. And the easiest way to do it is to have them in hot water, but that's certainly not the most appetizing.
Right.
So we're trying to come up with different ways to do that. I think from what I've gathered from other AAAs across the state, I think it may be switching into like how we transport the meals. You know, we've got the hot stones keeping the meals warm, but there's other products out there where it's an actual kind of like, you know, I think like Domino's has the bags you plug in and keep it warm,
Right.
stuff like that. We have a site manager, Carol, retiring after 15 years with the county. 12 of them were with OFA. She was the face and heart of a couple of our senior centers, and I talked to her today actually, and I asked if I could interview her for our next newsletter, so stay tuned for that. I thought she was gonna say no, because she's so humble, but she said yes. So we'll get all the deets on Carol, but that's, you know, bittersweet news that she's leaving us. One thing I wanted to point out, I brought these up a while ago, the Med QR bracelets. I have one to test out. If anyone would like to whip out their phone and test it, a little show and tell. Yeah, we got a speaker.
Sure, why not?
So I was gonna make up
You
some
need the
more
camera?
things. Yeah, you tap the top and it should, anything pop up?
My son.
Does it work?
This man.
If you get out of the camera and tap the top of the bracelet, I will get a text because I set up a test account. Are you in the camera?
I'm in the camera,
Get out of
out of
the
the camera.
camera and just tap the top. Or maybe hold it.
Yeah, right.
A credit card.
Let me check. Nothing.
Okay,
Didn't work.
well, it's worked on other.
Let's get another one.
It's definitely worked on other phones. I mean, it just popped up for me.
Yeah, let's show him.
So it might be, you can also use a QR code. There you go. We just had to hold it. So this will. You don't have
My
an
phone's old. No, I don't have an iPhone.
So you would have to scan the QR code. There's
Okay.
options for both, but what would happen is iPhone works. We have the same phone. iPhone works if you hold against the top.
Has all your high school grades in it? maybe?
Yeah. Are you impressed? A's across the board.
No.
So I got a text here that shows, because I put myself in as the emergency contact, I got a text here. Wristband for Nina Bambino has been scanned. You're receiving this alert because you're a registered emergency contact. And then you should be able to see, I just put in some basic information, yeah. And I tested it with some of the deputies in our building. It went a lot better than this test, no offense.
My phone's old.
They got it pretty quickly. But they said they thought it would be helpful. So I reached out to PJ Keeler to ask him, how do I get this information out if we start handing this out to folks? So I'm gonna give him some of these brochures and a little, probably this test one, and actually set it up with like a fake person. And then I also reached out to the county attorney's office. This was something you had brought up before about just a simple hold harmless agreement for any time we hand one out. I think we've got about 80 in total. So we're gonna kind of, I think, be strategic about who would benefit the most from having one of these. It's kind of a more high-tech version of one of those medical bracelets, right? So when you scan it,
the emergency contact is notified by either text or email, so they know that this person has been scanned or come in contact with emergency personnel. It'll bring up a photo of that person, their name, address, medical conditions, medications, anything that someone with dementia might not be able to communicate to a first responder. So they thought that that was really helpful. So that's exciting.
Is there a battery in it?
I don't, that's a good question.
Charge, yeah.
It's supposed to last a very long
Probably
time.
battery with little watch battery.
You know how many people, don't we have a list of people that are registered with 911 that,
Yes, in the sheriff's office.
There's a, yeah, it's a special needs.
are we targeting that group or this kind of?
I think that's a really good idea.
accessory? Yeah,
Well, obviously, there has to be a caveat that people need to be careful with the information that they're supplying.
right, but these are people that we're already monitoring, right?
These are people that, well, ideally-
I'm talking as far as someone on the street walking by, like they could with your chip in your wallet.
Oh,
yeah, I mean, it's only gonna share information that you put into it. And part of that whole harmless is gonna be, once we hand this off to you, you're in charge of what you do with that information. And anytime it's scanned, the emergency contact gets notified. So even if someone does walk by and scan it, that emergency contact is gonna know immediately that it's been scanned by somebody.
I think a lot of those people on that list are not people that are out and about a lot here. You're not
It
confronting them
doesn't tell
on
you
that.
who scanned it though, right?
It doesn't tell you who, but you could go in and when you build that profile, you could just put the emergency contact information so that whoever scans it has to call to get the information.
But somewhere, someone knows who scanned it. Somewhere.
Right, yeah.
So that is kind of exciting. And then the other thing that wasn't exciting to start, but got more exciting today was, I'm sure you've heard now that the kitchen on the Philmont was vandalized. The side of the building was tagged with graffiti on the actual mural, a couple windows were broken, et cetera. I was contacted by someone from the Philmont Beautification Inc. today.
Oh, Sally Baker. Yeah.
Who was an absolute pleasure. We spoke for like an hour and a half today. They're the ones that did that mural on our building 20 plus years ago. And she told me all the history behind it, which I thought was really interesting. We're going to try to get some photos of when it was done up, kind of a write-up, put it in our newsletter, talk about it at senior day, because I think knowing the history behind the mural is important. And then she also wants to work together to either restore or redo the mural. So my question for all of you is, what are next steps on how do I move forward with partnering with them? What information do I need to collect?
People to volunteer to do it, or?
So the way she kind of threw it out there to me was how they did it 20 some odd years ago. They partnered with the Taconic Hills School, and they got a grant, something related to art, a residential artist,
Okay.
Who came in, worked with the art program at the Taconic Hills School, was teaching the kids in their the high level art classes. And then they worked on a project to create the mural and then actually went and painted it. At the time they had scaffolding up because it's a big wall. Where the graffiti is only about as tall as me. So I know I'm supermodel tall, but you won't need a scaffolding to do that. So
To repair it.
yeah. And she said she kind of examined it. She's an artist herself. It looks like it is fairly straightforward to be able to lift that black ink off and paint just that piece. Restore is the word I was looking for, thank you. But then there is the option to do kind of a larger whole thing as well.
Why don't you work with them to come up with a proposal and a plan,
Okay,
and then we can.
bring that forward. She was already gonna start looking at grants that we could look into to try and get it.
She's one of the
covered.
best grant writers in the county.
Yeah, she was telling me some stories about other grants she's
Mhm.
written. It sounds like a powerhouse. So not so exciting to start out, but turning out to be, I think a positive,
Give it a happy ending. They're the lead on who may have vandalized it, because it would be tragic if all this effort and energy went into restoring the mural, only to have the evidence see that as an opportunity to deface it once again, leave their mark, so to speak.
That is a good question. So to my knowledge, no one has been apprehended as of yet, but it seems like they have an idea. It sounds like it was like a group of teams in the area. They hit 3 other buildings rather.
Excuse me. Also on Friday, in tandem with this, I'll be walking around the Philmont property with Sergeant McMahon to do that SEPTED, I believe is what it was called. SEPTED, maybe, the security workup that they've been doing on the county buildings. So we'll be out there on Friday to walk around. Coming out of that, I can, just having had conversations with him already, cameras and lighting are things that we need in that parking lot area. But as part of that project, when they did the mural 20 years ago, that was why they did it, because it was a big blank wall and there were vandals at the time. And it was, the conversation went really interestingly. She's like, we've kind of gone back 20 years. We're not at that same point. So they actually got the kids in the town involved in the painting so that there was some buy-in to, you know, well, I don't want to mess up this painting because I did it or Jody did it or
The
something. So,
community service of the vandals, should they ever be caught, should be to help in the
to
rest.
Right,
push
yeah,
this-
right.
yeah,
There's a
that's
can of
kind of-
graffiti.
I think it came from the underground Philmont non-beautification.
Yes.
The deviant counterculture to those of the beautification.
Is there an insurance claim for the damage to the building?
I put the police report through to Jim Reagan. I believe he was working on that.
If we look at that in the context of the proposal.
And I know, I can't remember the company. I want to say it starts with an S. We're going out, I believe yesterday, to take a look at the damage to the door and the window to give us a quote on the glass work. I was just trying to figure out how do we get a quote for a mural, because it's not like it's painting the wall, you know, and then she reached out, which was.
Just say it was a Banksy. Raise that figure
Yeah.
right up
And
there.
then auction it.
A very famous artist that did it.
I think he actually was a really famous guy.
Yeah.
She said his name a couple times and now I can't remember him.
Somebody let it, no doubt, you know, right?
Yeah.
Okay, well, thank you very much. Any further questions for Dr. Van Leeuwen? There being none, I'm going to ask for Director Almasi.
We'll be out of here in record time. I don't have the agenda either. Seems like it's a particularly quiet month. Feels like it's been forever since I've seen all of you. Been away for 2 months. Yes. So nice to be back. Just 3 resolutions total today. 1 financial resolution, 2 general resolutions. The first of which is the financial resolution. This is seeking your support to allow the Department of Human Services to accept funds in the.
Further discussion? All in favor?
Aye.
Opposed?
Finish
If it said grant, it would be.
It's money.
They want to make sure this gets done in record time.
Coming our way.
Yeah, okay, duly noted next time. General resolution number 1 is to bring on a consultant, psychiatric nurse practitioner named Joanna Rusk. This has come about because we have a contracted nurse practitioner for 21 hours. She has asked to reduce her time by 7 hours. So to compensate for that loss, I'm looking to reclaim the 7 hours via this resolution.
And is the loss paying for this?
Yes,
In the budget?
yes, exactly.
I'll move it.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then last but not least, I don't quite understand the nuances of it, but I understand our machine that generates the postage within our department is out of compliance. Therefore, we can no longer use it.
We all had to go through this.
It was suggested, okay, so you're all, it was suggested that we go down and use the health department. I advocated on behalf of our department that we simply use federal salary share to purchase our own machine. I thought it was a bit inefficient to have staff go trekking downstairs to the health department and then back and forth. So federal salary share is what I'm proposing here. It's not an expense to the county.
Had a motion and a second. Any further discussion? All in favor? Opposed? Carried.
And then just a couple of things. I know I haven't brought formal report to all of you in a while because of my absence, so I'll bring that next time, I promise. But just big things on the horizon is that you may remember we talked about a vending machine, Narcan, fentanyl, xylazine test strip vending machine. It has been delivered. It's been placed at 325 Columbia Street. It's not been stocked or activated yet. We need the tech to come out. That'll be happening in the next couple of weeks. And then we'll be doing some publicity, of course, press release, promoting the machine itself
and how Columbia Green Addiction Coalition helped in that process of procuring it, etc. School satellite, we're slated to go live at New Lebanon. This is huge because we haven't offered a school satellite in a while. The need is significantly there. I don't have to elaborate to any of you in regard to that, especially in New Lebanon, because the hardship that exists for those young people to get from where they are into Hudson proper to, our location there at 325 is just immense. So the fact that we're bringing our service to them, I think, is huge. Now, what is challenging, and I just want to let you know, is that we may not be able to open it when school opens because of the New York State Office of Mental Health. They have never scrutinized an application for a satellite in the way that they are scrutinizing our application currently. I have no reason, I have no explanation, I can't explain it, I don't know what it is. There's been 4 rounds of a dozen plus questions regarding our intentions, how we're going to operate, what our certain procedures are. Some of them are quite reasonable, others are just a bit unreasonable. I'll give you an example. They asked about our medication management only policy and procedure. That is a policy and procedure that only applies to adults. It's a policy and procedure where if a person is with us as an admitted case for an extended period of time and they've reached their maximum benefit gain, let's say, we will just prescribe them medicine. They don't need psychotherapy. They may not need case management any longer. So we understand it's a hardship for them to go and receive psychotropic medication elsewhere. So our prescribers will just continue to see them for that and offer that. Nurses check in with them occasionally. So, we close the loop. It's not done recklessly in any way, shape, or form. But it doesn't apply to children whatsoever. Yet they are scrutinizing that policy and procedure. They asked about our after-hours on-call process, which we're obligated to have under our regulatory requirements through New York State Office of Mental Health. When we explained that law enforcement is the first point of contact, because that's how it's set up, if a person calls us after hours at our main number, a regular number, it's the sheriff's dispatch that picks up the call. And then the person doesn't have to elaborate. They just have to say, I'm calling for mental health crisis line. Then they switch it over to the crisis worker, and the crisis worker calls that person back. They took exception to that, to which, we challenged, because we basically said, what are you trying to say about law enforcement? Are you implying that, they would answer the phone inappropriately? Do you have a bias towards law enforcement? Because we explained to them that our sheriff's deputies, work wonderfully with our population. We have no complaints whatsoever. And it just went on and on and on and on. So,
And our sheriff's population is often embedded in the school.
as resource officers,
Right.
of course, as is the case elsewhere.
Right.
So it was peculiar that they dug in on that and other sorts of things, which is delaying them approving our amended operating certificate. We need that amended operating certificate from OMH in order to go live.
Yes, they don't object to how you operate out of the office where you are.
No, in fact, you may remember they came, they did an audit, and they gave us a 3-year renewal, which is the most we can get. And we brought that to them too, like, hey, why didn't your auditors scrutinize this, and this when they were here? There's no rhyme or reason to this. For whatever reason, they're doing a tremendous amount of scrutinization, which is frustrating because they've also been the primary encourager of clinics to open up school satellites. And, not that we're going to abandon this, but I gotta be honest, it's not a good feeling.
It's frustrating.
That, like, hey, you encouraged us to do this. We took up the cause for various reasons, all of which are good reasons. And now you're giving us such a hard time. I don't know how else to put it.
The other thing is, Tistry and I are meeting with Michelle Hinchy and the school superintendent and school principal this week or next, because their special, yes,
Okay.
because their special needs population is double what any other district in the county is. So this, if there was any place where we needed this kind of care, it would be in New Lebanon.
Agreed. They've been very receptive to it. They've already identified numerous children and families. We've started to work with some of them proactively over the summer in anticipation of being there in September. again, I think I've made my point, but just to put a final pin on it, we have to provide a photograph of the office space. And there was some benign item on top of a file cabinet, and they insisted that that item be removed. I don't know what to say about that.
Pokey van.
Right. So again, we're being, we're playing.
Hire somebody new to probably justify their job. How's that?
Gumby.
I was a CDC guy a couple years ago, had a maggot hat.
So just wanted to keep you aware of that. It is positive. We will be there. We will persevere, but we may be delayed. That's all. It's like, I expect a few weeks. Fingers crossed.
Have
That's
you,
all my answers.
have you updated this year, does she know?
No, but I can.
I think it'd be a good idea.
Sure, I'll give her a call.
Yeah,
Send her an email
especially if you're gonna
tomorrow.
have a meeting now. Right now.
I don't think that's on the agenda. It's something else that's on the agenda.
Understood.
But the numbers shocked me for that population.
Any other questions that I can speak to?
Thank you.
If my committee will allow, I have the one question I asked you this morning, and you said should ask Bob as well.
Sure.
It's how to quantify the need for supportive housing units within an area. If you have someone looking to build such a thing and they say, well, how many do you need here?
That's a really good question, and the quantification I haven't thought of, because it's not something I would do, but you can sort of take the population and just take the population over, certainly over a certain age. All different kinds of.
Thank you, sir.
More
Thank you.
for folks who are graduating, as they go into a skilled nursing. So, I would think, just looking at the statistics around all of our skilled nursing homes, and I really don't know what else to say. I hadn't ever given that any
What
thought.
was this?
We had it available to us when we needed it.
Did you ask Chris Brown?
I was gonna say, I talked to Chris.
Not yet. It was a conversation I had this morning, and my next meeting was with our Director of Community Services. So I asked him, and he suggested Bob, and yeah, most certainly.
Chris has a way to, I don't know what he uses. Is it the American Community Survey data he pulls? So he might be able to.
But he just pulls some good data.
All right, well, terrific. Thank you, sir.
Well, it's my pleasure.
Anything further from the committee? Anything from the public?
Motion to adjourn.
Second.
All in favor?
Aye.
Opposed? Carried. Thank you, everybody. Okay, I'd like to call the Public Safety Committee meeting to order for August 19th, 2025. Sheriff? How are you?
Hey, I'm well. Hi, everybody. I can tell Rebecca was going on vacation because she got it early. She was
Oh,
the
yeah.
first one. That's
Yeah.
why I ended up first.
I told her why she reminds me of my old secretary, and she'd go on vacation, she'd look at us and say, don't touch it.
Exactly.
The first is to give Mr. Bryan a raise, to change his title from a 15 to a 15B, which increases his base salary by $2,021. He is the only senior, I think, mechanic we have in the county currently. And he's working by himself until we get somebody else.
That went through.
Yeah.
I'll move it. Second. All in favor?
Aye.
Opposed? So carried.
Thank you. The second is to fill a deputy sheriff position. We had a deputy who did not meet all the requirements for his probationary period, so he resigned. And we would love to fill his position. Second.
All in favor?
Aye.
Opposed? So carried.
The next is to amend the budget for an insurance payout we got for vehicle repair.
Second. All in favor? Opposed? So carried.
And the next one is to also amend the budget to add monies we received from the district attorney's office.
Move it. Second. All in favor?
Aye.
Opposed?
How does that work?
So
There's
carried.
a case, there's a settlement, and the department gets a piece of it? How does that?
That's forfeiture. So by law, we owe a piece to, we received the money and we distribute it to law enforcement.
There's about formula for how that works.
Yes, I don't remember the exact numbers, but yeah, it breaks down.
It's in the, it's in the CPL. You can,
Yeah.
right, yeah. Glad to see it. Yeah. Was option to learn.
Okay, the next is for authorization to send two recruits to the Zone 5 Academy, and those monies for the academy will come out of the forfeiture funds.
The only thing I want to bring up, I probably haven't brought it up to you, but the cost to do this, I know this is coming out of a fund, but I still feel like those individuals that go through, and if they make it and then they go somewhere else, they should be reimbursing the county, at least for a portion of it. You know, we send people through the academy, they get through, and then, you know, we lose them, they go somewhere else. That's gotta be a larger discussion.
Yeah.
Because again, I don't know if we should talk about the whole amount, but I don't think it should be just, you know, we put you through the academy, cost taxpayers dollars, and then they go to state police, or they go to Catskill, or they go to wherever. So,
That's a good point.
Yeah.
yeah, I just think we need
You
to,
could have some wording that they have to stay with the sheriff's office for X.
or if you decide to
Another
leave, you owe the
category,
county
prorate that.
50% of the cost or something. you know?
Prorate, I mean, we do the same thing with like our DPW workers.
Yeah.
You know, we pay for their training for
Yes,
their
yeah.
CDL courses and stuff like that. We make them sign an agreement that they stay with the town for,
Yeah.
you know, 3 years.
Or
And
they
if they
pay
don't, then it's, you know, in year one, they pay 50%, and year two, they
You know,
pay.
if you put 5 or 6 people through, it starts to become real money. I mean,
If
so
they
it's
sign
something
it.
we really should look at.
I may be mistaken, I will figure it, I'll find it out for you, but I believe Zone 5 is a flat fee.
Yep.
And then you are also able to attend trainings
Okay.
for the Zone 5.
So let's look into that a little bit more at some point anyway. I think it should be a further discussion. Do I have a motion?
I'll move it.
Second? All in favor?
Aye.
Opposed? So carried.
Thank you. Thank
I
you.
just had one more question.
Oh, yeah, I'm sorry.
No, that's okay. So their recruits, are they on payroll?
Yes,
Okay, so they're paid salary during this training.
yes.
Thank you.
And the next is for a resolution during Sheriff's Week, which is in September. 14th through 20th. Second.
All in favor?
Aye.
Opposed? So carried. Any questions for the Salvatore? Okay, thank you. Thank you. Public defender.
Oh, there was that.
Good afternoon. I have one general resolution request, requesting authorization for the chairman to sign a maintenance agreement between Hudson Valley Equipment and the Lake County Public Defender.
All in favor? Opposed?
That's in city court, right?
So carried.
Thank you.
Thank you.
Thanks.
Emergency management.
We don't like it?
Oh, well,
You don't have to. You gave it, you can give it to everybody if they have questions, I'll ask. But Jim's not here to. go over.
I'm sure he'll cut it down. He's good at that.
Yeah,
Got a sharp
kind
pencil.
of his job. Yeah.
Yeah.
Or residential.
Yeah.
Well,
Thank you.
Yeah, I have a question about this. When you're ready.
Michael, slow down, all right?
He's still counting.
Well, first I'll go over the report quick. I'll be glad to answer any questions on our activity, and also I'd like to give an update on the multi-jurisdictional hazard mitigation plan. It was returned by New York State Dishes on July 31st they wanted more information on 4 towns. Our consulting firm contacted the towns, got the information, concluded it in a revised submission, and they returned that by August 15th. If you go by what the email says, it should be ready to go to FEMA with these changes. So, but, I'm not going to promise anything.
I'm still gonna say hooray. I'm still gonna say hooray.
Yeah.
Every step forward.
It's moving forward, right? So hopefully it happens. All right, the budget. As you'll see, if you've had a chance to look at it online on the agenda, we're asking for 2 increases. One is for our continued efforts to increase the salary of 4 deputy directors. We started this effort actually before COVID. We couldn't do it during COVID. We restarted after COVID. The board did give the directors a salary increase, which they happily accepted. And the last couple of years, we've been directed to reduce the budget, so we didn't ask for it. The manager's increase was 2.75, and I've asked to increase that by up to 5%, which is only an additional $1,105.15, split up amongst 4 deputy directors for the full year. And that would bring them up to, a decent amount. HR and payroll, or HR and civil services agreed to this. We had to go through a process a year and a half ago with civil service to take the salary cap that apparently has been on those positions for years at $4,000. So we went through that. After several months, New York State approved that. So the salary cap is $6,500, so it's $6,500 range.
How many hours are you thinking people are working in that role?
Several. It all depends. It's busy. There's been weeks when we're all working 40 hours easily.
Right. Yeah.
And then there's some weeks where typically with what has to be done, they're all working a minimum of 5 hours a week. Just from what I asked them to do to other things. Each one is split up. I have duties split up amongst each person. For example, Henry Schwartz is overseeing the hazard mitigation because he's done it before.
Right.
He's very busy.
Yeah.
Back and forth with the consulting agency and gathering information and all that. So he's definitely way more. But anyway, it's certainly deserved, and I honestly consider it.
I will say that during COVID, they were almost working full time.
Yeah.
Right. I mean, if they're working 5 hours a week and then some weeks 40, and they're getting paid 6,000 a year, like that's.
Well, right now it's 5,000. And in 2018, it was only 2,500 a year.
Yeah.
Even if you worked 5 hours a week year round, that would still be low. If you
Sounds like salary pay for supervisors.
Seriously,
A little high.
That's about what I make.
$2.54 an hour.
Right. But it's
No way.
Below my first minimum wage.
If you're under the emergency or emergency mitigation, it's important.
Yeah.
So I appreciate it.
And we're all available 24/7, and we do get calls.
Right.
Even if there's like a heavy rainstorm or thunderstorm, and it's affecting the most recent ones that affected down south of the county.
Yeah.
The state every 4 hours still wants reports from us.
Right.
It's really.
And the
Yeah,
one
just-
position makes more because of longevity. There's 3 that are at
Rob
52.
Lagone, or
Yeah, I
get a
check.
Rob Lopez, his position makes more because he
Of his
is the
experience.
grant, he manages all the grants. And when the grant allows it, he applies for the administrative costs, which he puts in
Helps
for.
offset
and it's
some of it.
reimbursed. So
Okay.
he's always, even before me, he's always gotten somewhat more.
Thank you.
So that's the part for the personnel. Any questions? All right, for the equipment part, right, currently we don't have a records management system, program for emergency management. We use Google Calendar, which is certainly not made to be a records management, software or program. We've looked at different programs. We've even gone to MIS after I was appointed and they helped us make up a program which didn't work. It didn't last. And we've looked at other programs. They're very expensive, as you all know, to start out, and there's an ongoing maintenance fee. The last 2 years we haven't because, you know, of the reduction. I'm asking that this be, one account be increased $4,500. Put it back to 13,000. This was an account that we had $15,000 in that we would use it for various things. And it went down to 8,500 due to budget cuts. I'm asking that it be increased back to 13,000. And we have a unique opportunity to piggyback on Ulster County's D-Land system. It's a program that's on the New York State contract, and it's used for managing disasters, for emergency management offices, to keep a record of assignments, to correspondence, communications, and we deal with multi-agencies for that type of thing. We do it now.
So if I'm reading it correctly, if we just went and got our own, it's about 32,000 a year. We have an opportunity to pay 13,000 to Ulster County to boost their infrastructure to allow us to piggyback on their system.
Per full year, yes.
And that's allowed. It's not like
Yes.
Elan, if they found out about it, would be like, what do you mean you're sharing?
Because the quote is from the vendor.
The 13,000 to upgrade Ulster
Yeah,
County.
well, 6,000 for this year. It would have done 6,000 from July to the end of this year if we did it. And then we assume, I asked for an updated 12 next year, we assume it'd be between 12 and 13. So, one thing is that we may be able to use it. Other counties have done it, are doing it. We may be able to use it for our threat assessment and management team. And, which would open it up to a grant paying for half of it. Rob's looking into that. He's already submitted the request, and we're waiting to see if they'll.
And then we would own whatever equipment was bought with our 13,000.
Well, we would be given licenses. I don't think there's any equipment. It's all mostly.
In line, but it's just
The
not
point
part
two.
of it.
Yeah, any equipment.
Was there training included in that?
Yeah, training,
And like maintenance, not maintenance, but support?
and they would handle the majority of it, Ulster County.
Yeah.
And we would, it allows us to share information with them, and any other county that has D-Land.
And do you have whatever laptops or infrastructure is needed to run the software and all that?
Yeah, well, we just updated out of that. We used most of that account this year to pay half of, the cost for 4 laptops that we use for desktops. They had to be replaced and updated.
Yeah.
So they should be good for a
That's
few
adequate
years.
to take on that
And
software.
the grant paid for the other half. The Homeland Security grants that we have are not available every year for specific things. Some years we use them for the hazmat team. Some years we use them for communication. Some years one year we were able to use it to buy the van because we were to borrow everybody's van for COVID. That really wasn't an option. Now, this other grant from New York State is not a pass-through grant. It's in the budget. It's in the New York State budget. So we're told it's pretty secure. So if we can use that, hopefully they'll approve it. Other counties are using it. It's a New York State contract program. So hopefully they'll just do it.
I looked up some reviews with people of like other counties using this, and what I saw is that most people gave high marks for it.
Yeah.
The major concern that people had is that it's a specific program. They're kind of like, if you just show up and try to use this thing, it's going to be confusing.
Right.
So that's the biggest barrier is like, you kind of have to be all in. You have to be like, yep, we're going to train, like all of us, we're going to be trained. We know how to use this thing. So when there is an emergency, you're not learning or how to do it. So I think that would just be my biggest concern is like, are you committed? Like if you do this, you're all
We
in.
would use it. Yeah, we would use it. They'd have to.
Yeah.
Right now, for my annual report that I give, I'm searching Google Calendar and emails.
Right.
And I'm keeping a list of all our activities. So I can tell you the date, what it was, if we attended virtually or in person. And if there's any additional information, we're going in the calendar entry and putting in the description. you know, it's really not made for that.
And this just logs it all and then shoots you out the report saying.
Well, no, that doesn't. This does.
This new
Yeah, oh, yeah, yeah.
You
This
just
is
log it in there.
This is a made for registration. Any questions?
I have a question, Chairman.
Go ahead.
But not on the budget, unless you have more to go.
What's that? No.
Do you have more? At our Board of Health we had a conversation, and the subject was the lack of awareness of food pantry availability in the area.
Yes.
And the conversation centered on the publication of your resources, and if the emergency management department would be willing to list food pantry availability in addition to many other things they did.
Yeah.
So maybe this is the committee to discuss that, allowing the publication of such.
So we weren't sure if there's a county department that keeps an updated formal list of food pantries in the county. And obviously it comes up as part of the health department, Board of Health, that my position is on. Does anybody, I mean,
I would assume they have that, but I don't know.
there's lists, but we were talking, it would probably be good to have one department, and we're willing to do it. You know, I would want a formal, resolution or whatever, assigning a department, and we're willing to do it. Keep a list of it, post it on our Facebook page. But we don't know if that's being done, and, it seems like there's a lot of them, and there's a need for it. And that was a discussion.
Did we check with DSS with Bob?
I haven't yet.
Because it does
No,
seem
but I
like it
can.
makes
I'll send
sense to, it might exist in his part.
I know.
Just to throw it out there, maybe including things like community fridges, like we have 2 community fridges in New Lebanon. We
Right,
have a
but even
food
if there's
pantry,
another
but then we
source
also
of it, was there any detriment to his department publishing?
No, more the merrier.
Right, I think.
Because they've got more followers than Lady Gaga.
Our Facebook page is followed a lot.
Yeah.
Henry Schwartz oversees it.
I mean, I would think my inclination would be to have, most DSS that post it, like having DSS be the one who creates the list.
I don't
DSS give it
care.
to you,
Even
and
if
you
you want them to post it, they have an app too. It doesn't matter to me. I would repost it,
Yeah.
certainly, absolutely, if they're the keeper of the list. I can tell you during COVID, we were tasked with also reaching out to food pantries to see what, if anything, we needed as well.
David, can you just bring it up can you email Bob, find out what they have, and then bring it back to this committee, and then we can.
Thank you for reminding me that.
It's almost 2 different cohorts, too, the people who need it during an emergency and the people who need it day to day.
Right, it could be on
Oh,
both
yeah.
places, I think it's,
Well, food insecurity was a lengthy discussion at the board meeting, so. I think there's more than what people realize, and it would be good to post it somewhere and advertise that it's here.
Yeah.
You could go and look at this.
Have the hours.
We're willing to do it. I don't want to push out, I don't push anybody out.
The more the
And
merrier.
I'm absolutely happy if you want DSS to do that, and we will post it as well. But however you want to do it, but I think there needs to be an official place to post the information.
anything else? Thank you.
Sure.
Fire coordinator, he's not here. So, accept the resignation of the following hazmat team members: Charles Shook due to health reasons, Albert Kastner and Ricardo DeGroff Jr. due to the fact that they are no longer active in a fire company.
Move it.
Second? All in favor?
Aye.
Opposed? So carried. Accept the $10,000.
Move it.
I need to go in front.
That's
First and a
great.
second, all in favor?
Aye.
Opposed? So carried. Accept a donation of $500. All in favor? Opposed? So carried.
Rob,
Yes.
take you back to resolutions. The resignations were accepted. Do we have replacements for those resignations, and what's the process for that?
George usually nominates,
Yeah,
replacements.
they'll bring it back to this committee.
Okay, thanks.
You're welcome. Okay, was that it? Oh, no, this was- So now we got EMS. Mr. Keeler, how are you,
Yes,
sir?
I am fantastic. How can you not be in weather like this? Huh?
Terrific.
It's good for everybody. I didn't know if we were doing the budgets or not, but Bubba said we're doing the budgets, so I guess we're doing the budgets. So I'll pass these around.
I don't have one to discuss.
I know, because I didn't send it. There you go. While they're doing that, while we're passing them around, all I wanted to do is just give the committee an update on, chairman appointed at the last board meeting, the EMS Finance Work Group. And, just to keep you up to date on that, we did have a meeting, and, the purpose of the work group obviously is multifaceted. Number one is obviously to keep our EMS system from failing, such as other agencies have done around the state. I told the committee that basically our statistics show that 25% of the EMS agencies in New York State between 19 and 23 have either gone out of business or reduced their services substantially. So obviously the chairman of the group has realized that we need to make every effort possible to keep these agencies in business, because we don't need to have that happen here in Columbia County. So we're looking at ways that we can possibly stabilize these agencies from a financial standpoint, and how to equalize the cost and maybe do alternative funding compared to the way that you fund the agencies now, town by town. So that's kind of where we're at with it. I think 3 or 4 of the supervisors that are here are on the committee. It was a good discussion. It was a very good discussion. And one of the ways Supervisor Adams came up with her concern is, if we're going to do it county-wide, how can we include the non-taxable parcels as well? So that's obviously up for discussion at our next meeting. So just to keep you up to date on that. As a sidebar, it was noted, Sean Grogan, the administrator for Greene County, announced that they're moving forward with their countywide system. Projected cost up to $15 million. So it's a substantial system. They expect that they're advancing it starting in the fall, where they'll be looking to hire a supervisor and back office personnel. Therefore, we'll be creating a whole department. So it's going to be quite expensive, but they are moving forward with it. And they anticipate hiring medics and EMTs probably in the second quarter of 26. I tell you this only from the standpoint of that will probably put some pressure on staffing here in Columbia County, because this will be a municipal system, and the medics and EMTs love to work for municipal system because of benefits and also anticipated wage increases that will go along with it. So I hope that our committee can move our progress along fairly quickly, because I do see a crisis possibly coming on the horizon.
What's their projected budget over there? I know you
15 million. So, okay, you have the budget in front of you. It's not exciting. It's pretty level. As a matter of fact, it comes in about 2.3% less than last year overall. And part of that is due, there's only a couple of increases. One was a $3,000 increase from contractual expenses. We have a system, it's called EMS charts, and that's a contractual system that all the agencies use. The county picks up 70% of that cost, and the agencies pick up 30%. And there's an increase in that price. The other one was $1,000. My deputies have never had uniforms. And we've had a few occasions where they kind of need it and they kind of feel out of place. So I'd like to at least pursue that. And I projected a $28,000 increase in revenue due to the transports and the contract we have with CMH and moving patients out of the emergency room. These are 911 calls. They are acute patients that need to move very quickly. Usually it's for like a cardiac cath or something like that. So we will be obtaining additional revenue for there. So that's it.
Any questions? Thank you.
Yes. Number, a shared number,
I'm
is
sorry.
that the county share, the 28,000, or is that the full share? The 28,000 that you're projecting for
That's the counties.
the county share,
Yes.
which is,
Yes.
EMS? I'm sorry, 911?
You think everyone? Just have one, resolution request to transfer some funds. Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
I do have the budget. Pretty boring. I was pretty impressed that I was able to decrease a little bit, but PJ just stole my thunder. He decreased us a lot more. We're not really asking for anything new. We are asking to bolster a couple of accounts, but they're offset by reductions in other accounts. So basically all we're doing is accounts that have historically come up short. We're trying to move some money into them so that doesn't continue to happen. That's why I just had to transfer funds. There's really nothing new in here. So unless anyone has questions for me, but we're not asking for.
Questions? Thank you.
So you're decreasing your budget, I think we are, questions.
Thank you all.
You get an extra.
Thank you.
One for you.
Kelly, you're doing one?
No, I'm good, thank you.
I see the DA's here. Do you have anything for us? I know you're not on the agenda.
I'm not on the agenda. I do have my budget with me.
I don't think anybody's really taking a peek if you want to.
Probably not. I mean,
Yeah,
look,
it's just, I got it this afternoon.
no, I understand.
Yeah.
The memo that we got, was to appear today. So here I am.
Okay.
From Ms. Vaccaro.
Present it.
I'm happy to hand out 11 copies. But
Yeah, if you want, sure, come on up. Are you Savage Jim?
No, he just got it today as well.
Okay.
Give it out and we can have a discussion at a future time.
Or if yours is on legal paper.
Nobody else probably has it in their printings, right?
You wanna walk us through any changes?
Yeah, we'll take it. Keep coming.
Oh, you know what? There are cover pages here that I can give you. Let me give you the covers. Give you just the stack of the rest of the handout.
And I'll take two more this direction.
1, 2, 3. And then, who does not have?
Yeah, we're here.
Sir?
If you know, man, out even better.
Are we covered?
Two more.
These two more.
You guys don't have them yet.
No.
See.
You're just passing around.
There you go. Thank you.
There you go.
Thank you, sir.
And since I'm here, I just would offer that if anybody has any questions with respect to the DA's office, I'm here, happy to answer. You guys are easy.
Yeah. That was quick.
I'm not gonna stand up there too long.
Thank you.
Yep.
I got it more.
Yeah. Any questions from the committee? Any questions from the public?
Adjourn.
Second.
Second.
All in favor?
Aye.
Opposed? So carried. Thank you, everybody.
Thank you all.
Okay.
It's a public meeting, so it's okay. We're recording.
Is it that bad?
Yeah.
So we've decided on, the CDPHP with the CD Capital RX as the plan to continue with. So if everyone's all right with that, we need a motion.
I'll make that motion.
Second? Second. Discussion. All in favor?
Aye.
Opposed? Carried. Thank you.
Wait, did you just end the meeting too?
I didn't.
Oh.
I missed it.
Yeah, I'm ready.
there's not, there's not.
You need that?
Motion to adjourn, but I'll make it.
Well, is there anything else to be brought up? With that, I'll entertain a motion to
Motion to
adjourn.
adjourn.
Second.
All in favor?
Aye.
Opposed? Carried. Thank you.
Terrific. Thank you, everybody.